And we are here to welcome Bekah Shephard, the author of A Nurse in Your Purse. I heard Bekah on another podcast, and that was which one, Bekah? I forgot the name of it now. She was
the
from,
New Moms podcast.
That's it, right? And so I had to come track you down because I think I went straight to your book first, ordered it, and then thought, oh, she would be perfect to have on a call with us because you cover so many of the things that I know as a mom of many that I've had, issues of, you bring this baby home from the hospital without instructions. And I feel like this is almost an instruction book, that can tell you everything you need to know, especially when you hear a lot from the doctor's offices and from well-meaning, parents, friends, and so on. But there's so much information out there that bombards you, and as a parent, you have to kind of sift through all of that and decide, how am I going to raise this baby? Because it can be different. And I know for myself, I think I've done all the extremes possible because I've had lots of practice. But from the first one with just deciding to go exactly everything in what to expect when you're expecting and all of that, and the new baby, I forgot what that first book was called after that. But and then the second child, I just went the other extreme. I mean, I call them extremes, and maybe people are in one of those two places. And then I had twins after that. So that was my survival mode. I will just do what I can do to keep myself, my husband, and the children I have alive. So there's just so many in-betweens there. And so why don't you start by telling us what kind of journey you have been on from becoming both a nurse and then a mom, and what led you to write the book?
Yeah, thank you for having me. So I've been a nurse for a little over 10 years now. And about 8 of those years, I've worked strictly in a pediatric clinic. So regular doctor's office, pediatrician's office. And I have always wanted to work with kids. And so going into pediatrics it was just a no-brainer when I went into nursing school. And then I ended up having my firstborn shortly after starting at the clinic, and everything kind of changed. And it was like, I'm a nurse and I tell people how to do these things, but once you become that mom, it's like, ooh, this just takes on a whole new meaning. And so even as a nurse mom, I totally get being scared of, my kid has the runny nose, my kid has a fever. And so working in the clinic, we would get those same questions over and over from all new moms. It was just kind of a repeat pattern that I would see. And so I really wanted to write this book for the moms that needed it and couldn't call the doctor's office or had to wait until morning to get that call back from the doctor's office. And because you could hear, like, in the voicemails that we would get from parents, from moms, they're really worried. And it would just break my heart that they had to sit there all night wondering what to do for their baby when it wasn't necessarily an emergency situation. And they just needed that call back from the doctor's office. So it really was kind of for those moms to kind of help calm them down. It's okay. This is what you need to look for. This is what you need to watch for. This is what you can do in those kind of middle of the night situations. So that's really kind of why I wanted to write the book, was just to kind of be there in the middle of the night so that they had something to be able to grasp. It wasn't Google that would tell them 30 different things that's going on with their kid, and they're still as confused as ever. So
yeah, and what I like too about that is it's a book you can keep in your diaper bag, or if you're going out and about, or your purse, obviously, because that's the name of it, or by your bedside. And so it's really nice to be able to just like flip through. And, some of them are not big issues, not big deals. And then others, you're just kind of like, oh, I don't know, fever. How, at what point do I need to go take my child in? So, and I know for myself, a lot of it was the thought of, if I go into the doctor's office, there are sick kids in the doctor's office. And even just by being in the waiting room, and I usually had a toddler and a baby, and knowing that we're being exposed to other sicknesses, is my baby's deal important enough that I have to now go and possibly come home with a cold when we just wanted to find out the question too, is this just teething, or is there something more serious? So it's that was always a frustration of even the baby well checkups. I remember doing those early on. And then like I go in healthy with my kids and then we come out not so healthy because there are sick kids in the waiting room.
Someone
So,
gets sick after
yes,
leaving. It's
yes,
true.
that was
Yep.
always a frustration. So
It's very true.
So what are some of the questions that you got most from the new moms, either on the voicemail or when they came in? What are some of their biggest worries?
The most common questions we would get asked was about baby poop.
Okay.
So,
So what kind of like, is this right? Is this the right color? Is this the right?
yes, the color, the consistency, how often they're going, those were always the calls that we would end up getting a lot about. And not just for babies, it goes into toddlers too, because you're potty training, you're all about their business. So it would go all the way up to toddlers and that kind of stuff too. So
what kind of answer would you give them what would be like the most normal, like maybe what would the mom coming in ask specifically about it if it was diarrhea or something? And then what's the most normal that you really don't have to worry? And what would be what kinds of things would you advise them to watch for when it came to baby poop? You can give us like a nurse's perspective.
Well, and it's going to differ from whether the baby is breastfed or formula fed. And it's going to differ within the beginning stages of an infant, because when they're first born, they're pooping out the black sticky stuff that doesn't want to come off their butt. And then if you're breastfeeding, it's going to be seedy and it's going to be runny and it's going to soak into the diaper. And a lot of times parents will confuse that with diarrhea. But breastfed stool is not diarrhea. It's different. A lot of times with diarrhea in the little ones, we want to look for other symptoms going along with it, or if it's a drastic change in their bowel pattern. So within those first few weeks, baby is pooping all the time, and most likely they're not going to have diarrhea unless they have other things going on as well. So you'd be watching for other symptoms other than just diarrhea. But as they get older, the bowel patterns kind of slow down a little bit, although we do want babies to go at least daily. Breastfed babies can go up to 5 days without having a bowel movement.
And that would have been me calling you. That would have been me like, oh my goodness, it's been like 4 days or 5 days. And that would have, I would have started to freak out. So yeah.
And they can go up to a week, but usually at the 5-day mark, that's when we would always say, give us a call. We're going to ask you some more questions just to kind of find out what's going on. But breastfed babies can go up to 5 to 7 days without having a bowel movement, or they can go after every feeding and you're changing a diaper after every time you nurse them. So you've got it can be one or the other. And so just kind of understanding that this is normal and this is normal can kind of help calm it down a little bit. And then the formula fed babies are a little bit different. Formula acts differently in their body. So typically we want the formula babies to be going at least once a day. They can go a couple days in between, but typically formula keeps them fairly regular on that one.
Okay. All right. This is a weird question that I just remember thinking in my head. I don't think I ever read it anywhere, but I always thought that my baby's newborn's poop smelled like buttered popcorn. Have you ever noticed that?
The breastfed poop smells sweet. It's got like a sweet kind of smell to it. Formula fed baby poop is very stinky. There's a huge difference. Yes. There's a big difference in the smell. So,
and I did both in different children that I had. I always had like a milk supply issue and just always had to get that going. And but I just remembered, like, if I had that buttered popcorn smell, I knew that was breastfed baby poop, and I was super excited about it.
Yeah, because it doesn't really smell bad. No, it doesn't. So,
no. And I know others will have those huge. Well, did you have moms worried when they had a huge blowout? Because I know.
Yes. Yeah, like the blowouts that like it's all the way up all their over. Hair, and yep. Because you think how much poop can be in this little itty body, but yeah, that can be normal too.
Yeah. Okay. I'm curious to know, when moms come to talk to you, do they tend to be on the overreact about any issues that may not be a big deal, or you see them as, I kind of wish they would take this a little bit more seriously because this could be a big deal?
Usually the overreacting. But honestly, I think that is, that's just instinct, honestly, because that's how you keep your baby alive, you know?
Yeah.
So I would always say, if you feel like something's wrong in your mommy gut, I don't care if it's a silly question or you think you should know the answer to it, call your pediatrician, call your provider and ask. I mean,
Yeah.
that's what we're there for as, you know, a nurse. That's what I love to do. I
Mhm.
want to provide that education for you. So it's usually more on the, nope, this is normal. They're okay. You're just going to watch for this, this, or this. But we'd rather you call than if you didn't call.
That's good to know, because I'm sure there's people that's like, I don't want to bother because this is probably something I could just go maybe Google, and but I still feel like I'm not sure. So it's good for moms to know that no, it's okay to call, and you could, yes, you can ask all your girlfriends what they think, but maybe you should just go straight to the nurse because they're happy to answer your questions. So that's a good reminder. I'm glad you said that because it's a good reminder. Okay, Josie was asking about where to buy your book. And by the way, Josie, I have given this, let's see, I gave one to Carrie because Carrie is she's having a grandbaby pretty soon. And then I have a mom who's actually in labor right now, a friend who's in labor. And I gave her book already because she had a baby shower a couple weeks ago. And this pairs really well, everyone, with the Simply Soothing Rash Stick. And we have that as a freebie this week on orders over $45. So you put this and you put the Simply Soothing Rash Stick with it, and you can put some little mom advice in a card. I mean, that's a great little gift. So Carrie put the link in the chat, and then Carrie, if you could put that on Facebook too, because it's on Amazon. And Bekah, there's like, when I went, I think the other day to check, there's like 10 available if you want to get it quickly in the next few days. So it's nice. And I think that they do print on demand and ship, right? So
yeah. And actually you can get it from other book retailers too. It's available at most major book retailers. So Barnes and Noble, you know, kind of the major ones in your local area. It's all print on demand. So if you can't find it on Amazon, then you can always check on those places too.
Yeah, that's good to know. And it might even be a good idea just to, because I'm keeping one on hand too, so that if I have a quick, you know, I need a gift for a new baby or something, a new mom, then it's readily available. And I'll tell you real quick, those who are watching, how it's broken up, because I know sometimes you want to see something before you buy it. It has 2 pages about per topic. Yeah. Oh, there you go. There's
about that. And they're not long.
No,
it's very straightforward. So there's no fluff. There's no any of that kind of stuff.
And I like the drawings. Did you do those, or did you have someone do those for you?
No, I had an illustrator that helped me with it. So she did the drawings, and then I did the layout and the publishing and that kind of thing. So
yeah. So
anything, beautiful work.
Yes, it's so. I mean, look at that baby bottle. It's so cute. Oh yes, there is a Kindle version, Carrie. I saw that too. Yeah. This is a huge question. I remember. Oh my goodness, how much to feed baby, or how much to know, and if you're not bottle feeding but breastfeeding, how much is baby getting? Those are huge questions. The stuffy nose question is a super good one. And okay, we're going to move into let's go talk about diaper rash, because we're talking skin at Made On. The diaper rash chapter, it's about 3 pages. And then you also talk about yeast infection. So tell us, with the diaper rash, first of all, how can you treat just the regular diaper rash? How can you prevent it? And I think, Laura, we'll get to your question in just a minute. That's a good question. And then when do you know whether or not it's going to be a yeast infection? And at what point do you need to go see a pediatrician?
Okay. Well, diaper rashes, they range from hardly anything to severe. So your severe diaper rashes, you're going to have the raw bum, you're going to have the bleeding. It's going to be very much bright red. The best way that you can prevent it is really kind of basic stuff. You want to change diapers often, especially the poopy ones. You're going to want to make sure that you're also cleaning in between all those cute little rolls and folds and all those places that like to hide poop. And for girls, I'm just going to say this, for girls, you want to make sure that you are cleaning in between their folds of their labia, and you're going to have to spread them a little bit. You're going to have to do some good cleaning. Boys, it's a little different, but the girls, you really got to get into all those kind of folds. if a wipe seems to be kind of irritating to your baby's bum, just use a warm washcloth. It's totally okay. A lot of times I think moms don't think of that, where you're like, I don't really want to use a washcloth on there.
Would you
But
even,
sometimes you can.
would you recommend if you are using wipes like the fragrance-free wipes, and just in case they're allergic? Okay.
Yep, absolutely. And then you can also use a diaper cream preventively. Like you can put it on there every diaper change if you want to. That's kind of a personal preference. Or if you start to see a little bit of redness, then go ahead and put it on there, kind of thing. Sometimes the diaper rashes will really kind of just appear suddenly. You're like, whoa, where did this come from? So just making sure that you're aware of what's going on down there and that kind of thing. And there's lots of diaper creams
That's what we
to
sell.
choose from.
That's what
there
we
you
have.
go. Well, and I was going to say, like, make sure they're minimal ingredients, that there's, if you can't pronounce the name of the ingredient, don't get it. I mean, the baby's skin is like a sponge, and they just absorb all that, and it goes into their body, and their body has to process it. So you want to have as minimal, chemicals as possible.
Yeah, in fact, let me grab one real quick. It's really the zinc oxide, that the whiteness,
Yes.
and the zinc oxide that does the best. And when we were starting to make ours, I was just looking at a Desitin, and it said like 37% zinc oxide, or on the most, the one that had the extra strength. And so when we just put zinc oxide in there, and we didn't have shea butter, but we've got like the coconut oil and a little bit of beeswax, it just made a perfect cream for that. So really it's zinc oxide that does it, which is super safe.
Exactly. Yep. Yeah. So, I mean, anything that's got that in it is going to be something that repairs the skin. So you can put it on preventatively. You can put it on at the first sign of redness. A lot of times, a lot of times when kiddos start their first foods, their body is flushing out the foods and things that it's not been used to, and their skin isn't used to it. You can really see the flare up of the diaper rash kind of going on.
So that doesn't mean they may not necessarily be allergic to that food per se. It just means maybe just start with one food item at a time, let the body get used to it before starting introducing a new. Okay.
Yes. Anytime starting new foods, you start with one food. So not a combination, not like apples and butternut squash. You just stick with the squash, and you do it for 3 days. And just because they get a rash on their bum from it doesn't necessarily mean that they're allergic to it. Their skin is sensitive down there. It's processing something that's never come out that way before. So the skin can get a little bit irritated. Eventually it does kind of go away. If it doesn't, then you want to talk to your provider and kind of see, okay, what's going on? Is it too acidic? Is their body saying, I'm not ready for this yet? That kind of thing.
Okay, good.
And for those severe diaper rashes, like the bleeding and the raw, and they're you just don't even want to touch it because it looks like it hurts so bad. We have seen those, and a lot of times we'll recommend something that's called magic butt cream. It's a fancy name. And it's basically, it's the zinc oxide. So like we would do Desitin or whatever kind of cream that has the zinc oxide in it, and you mix it with triple antibiotic ointment and camel septine. And a lot of times for that severe diaper rash, it really helps treat it, helps calm it down a lot faster than just doing one or the other.
Okay.
With it. So you could probably mix your stuff with that too, with a little bit of an antibiotic ointment or that kind of thing, and it would probably work just fine.
And is that something that you would just, an antibiotic they could just get in the store, or do you need a prescription for it?
No, it's just an over the counter. So you could get like Neosporin or triple antibiotic ointment or that kind of thing. Okay. It's just to kind of help repair it and make sure the bacteria count kind of stays low and that kind of thing.
All right, good. And a skin issue that I know I had dealt with my babies was cradle cap. So how do you get rid of that?
Cradle cap is actually fairly easy to get rid of for most of the time. So in our office, we have those wonderful little surgical brushes, and we would always make up a little newborn packet, and we'd always put one of those in it because it's on one side, it's got like a little sponge, but then on the other side, it's got those soft, rubbery bristles, and they're fantastic for just scrubbing in baby's hair. So really, all you need to do is get like a little scrubby brush, and you can get them online. They're in the stores. I mean, they're everywhere. They just have the soft little bristles on them. And you want to make sure that you're using a gentle shampoo. Try and stay away from the perfumes, the harsh chemicals, that kind of thing. Or you can use just coconut oil or baby oil or just water and the little scrubby. And you just use that brush in a circular motion on their head. And when you're doing bath time, and then you just kind of rinse it off. You can do it a couple times a week. When the baby's real young, really, they should only be bathed, every couple days anyways. So just do it at the bath time. And then in between times, you can use on the scalp, you can use baby oil or coconut oil or, whatever kind of oil of your choice that's made for skin, and just kind of keep it in there to help keep it moist.
Okay. And is
But
there
don't pick it off either.
Okay. Well, we might have done that, so that's good to know. and then that would be too much if you're trying to scrape it off or pick it off.
Yeah. You don't want to pick it off because it'll just expose that skin underneath. It will go away. It really does. There's some severe cases where you'll see it start to kind of creep down their forehead and that kind of thing. And you just kind of want to keep it moist with the oil and that kind of thing. And you can even use the scrubby brush on their forehead if you start to see it come down. And if it's not getting better, or you're like, this doesn't look like cradle cap, then make an appointment, have the provider, take a look and just make sure, because rashes can look crazy and funky at sometimes. And it's sometimes disconcerting to see the scaliness on the forehead of the baby, but it happens. So it just
I haven't had that. I don't know if I've even seen that, because I haven't personally had it. Thankfully, it didn't go all, go down to the forehead, but that's good to know. Okay.
We've not seen it often, but there's been times where, it comes down, and it can come behind the ears and kind of down to the lower neck and that kind of thing. But it eventually, just kind of scrub it with this little scrubby brush and it goes away.
All right. And then what about baby acne?
There's really nothing you need to do about baby acne.
Okay. That's nice to know. Just let it be and keep it clean.
Yeah. Okay. Some moms like to put like breast milk on it and that kind of thing. It typically is going to go away on its own, though. There are some baby acne where it gets very severe. But as long as it's not looking infected, it's not, inflamed and bright red, there's no pus coming out, that kind of thing, you can just let it run its course. There are some, like I said, the breast milk and that kind of stuff that some parents do like to do. You can also do things, and I think I have them more detailed in my book, but there's, you can do like diluted witch hazel on a cotton ball to kind of clean it. Apple cider vinegar, diluted, obviously, and then staying away from the eye area and that kind of thing. Okay. And then because they are finding like all sorts of issues related to the guts, always doing like a probiotic for mom if she's nursing, or for baby if need be, can always help too. But it goes away. I remember my daughter she just looked horrendous for Christmas photos because she was about a month old, and that's when baby acne hit, and she was just so, but it goes away. So it doesn't look pretty, but it's not harmful for them. So
good to know. All right. Carrie, do we have questions? You want to read off some of the questions that came in?
We do not have any questions.
Oh, I see a question. It's to me directly. I see it on my end. Okay. Flora is asking, this is a good one. Okay. Her baby is 5 months and has eczema. The pediatrician said that she's too young to get an allergy test. Is that the case? And also, is she too young for an iron and a B12 test? Because she has read some anecdotes where being low on either can affect eczema.
I'm not sure on the iron or the B12 test. Most certainly lab work can be done. It's different for different ages on how accurate it is. It also depends on whether she's nursing or not, because if she is, then she could potentially increase her intake of those, and baby's going to get them. Eczema, I'm not an expert in eczema. My son had eczema and we discovered his was from his food allergies. So a lot of times with eczema, if she, now I don't know if she's breastfeeding, has started foods or not, but if breastfeeding, then taking a look at what she is eating herself. A lot of times the major culprits can be dairy, soy, wheat, eggs, the major allergens. But you want to be careful if you're going to try cutting those out. It's kind of an elimination process because you still want to make sure you're getting enough calories if you are nursing as well. So keeping a food journal of what you ate and how baby is responding, whether it's an eczema flare-up or maybe you notice their stool is off or they seem extra fussy, and starting to kind of keep track of those symptoms and piecing those together, that can be very helpful in trying to track down if it is food related. They are finding that a lot of, like I had mentioned earlier, the gut and the gut health and that kind of stuff, they are finding a lot of it is connected to eczema, and a lot of people, once they're able to heal the gut, are able to get rid of their eczema essentially.
Yeah, she
So,
says she is breastfeeding and she's eliminated a lot of those items that you've mentioned. I'm trying to find, I know of a website where this gal, Eczema Expert, she's in the UK. If I can get her.
and the other, like when you eliminate the foods, they can take different times to process out of the breast milk. I think dairy is the longest. I'm not 100% sure on that. I think dairy can take like up to 6 weeks to get out of the breast milk, and then you have to wait for it to be out of baby's system completely. And then a lot of times too, well, at least like with our case, we found it wasn't just eliminating those foods out of the diet, it was also healing his gut and getting the foods that were healing to repair that lining in his belly.
And how
as
old
well.
was he when you were dealing with all of that?
He was, well, we had confirmed allergies at 11 months.
Okay.
And then, but he had symptoms. He had symptoms that literally started day one in the hospital. But the eczema really started around probably 4 to 5 months old.
And how would you know an age that is, what about what age can they do an allergy test? Do you know?
I know like at our clinic, they, depending on what it was, and how severe the reaction was, they would do allergy testing at a year. My son had a skin prick, at, I think he was 13 months when we finally got in. And then you can always ask for a referral to an allergist as well. If the provider doesn't want to give you one, you can call the allergist yourself and say, what do I need to do to set up an appointment? Because a lot of times they don't necessarily need one depending on insurance. So
Okay.
insurance takes a lot.
I'm going to put your link in here because I know you did your whole story. I think, is this the one? I hope this is the one. Yeah.
I think so.
Yep.
Yeah.
Showing your cute little baby. Oh my goodness, he's adorable. But Flora, go click on that link before the call ends because Bekah's got his whole story here. So everything that happened and at what month and so on. So that will be, especially as related to food allergies, I think that would be a really good resource.
And I can't stress enough, like if you think it is food related or you're just trying to figure out what's going on, keep a journal. Keep a journal and write down what was eaten, what happened to baby, how many times they puked up or spit up or what their poop looked like, and just keep track of it because it's so much easier if you do have to have that appointment to look back and say, this is what's going on. And I think we're connecting it to this.
Yeah. And so not just the baby, but what mom is having if she's breastfeeding.
Yes. If you're nursing, yep. We want to know what you're eating. And sometimes it's not the big allergens. Like my oldest would react terribly to if I ate peppers or chili of any kinds, and she would just have horrible poops and she was just uncomfortable. So it doesn't necessarily have to be huge, the big allergens. It can be some funny ones, you know. So keeping track and writing that down is always very helpful.
All right.
Sounds like nightshades.
Oh, yes. Carrie is a functional medicine and expert. Come in and give some advice on that one. I'm gonna, let's see, we're finishing up here, but I want to, Carrie, can you put the link in to her website? It's actually easy to remember, bekahshephard.com, but you got to remember how to spell Bekah Shephard. So
Yes.
there's that, because there's many different ways. And then you're also going to be, I think I signed up for it actually. You are going to be speaking at a summit. Is that next week? Starting next week?
It starts, it actually runs for 3 weeks in November. It starts November 1st and it goes through the 19th. And on the 19th is when I'm actually speaking. And I'll be talking about some of the most common health concerns of babies and how to deal with them. So we're going to talk about poop, and we're going to talk about first foods. And I think I'm talking about umbilical cord care, and that kind of stuff. But it's a summit with there's like 15 or 18 other speakers, and they all are experts in one area or another that has to deal with being pregnant or postpartum. And it's stuff you don't hear from the hospitals. It's stuff you don't hear from your pediatrician's office. It's stuff you don't hear from your mom. So, it's in their resources that you would never even think of. So it's a good thing to have. And you just register for it. And they'll send you the replays if you can't join live, but you can join live like this and ask questions and things like that too. So.
And it looks like it's free to sign up, and you could probably buy, if you want, the entire, collection. I'm assuming that it's probably something you could purchase afterwards, but it starts out free.
I think if you don't register, then I think they're offering a purchase afterwards. But if you register, then you're sent the replays. So.
Okay, that's, anybody who knows anyone who is expecting, and whether it's their first or their ninth, you can still learn so much in between. And I think it's great to have a resource like this, like your book and like the summit that you're going to be speaking at. So, all right, so this is on Amazon, and you can download a chapter, kind of see her writing style. It's actually it's easy to read, and it's just chock full of information. Oh, I need to say what's in the back too, because I thought this was really good. So here is an example of just charts that you can also get access to, and what to jot in at the different well-child visits and what to expect. Let's see what else. Also the first food. This is good to have, because I know I didn't write everything down, and it's so much easier, because even if you have no problems, you have just the perfect baby, if you at least start this anyway and get into the habit of doing that, then when a problem comes up later, you have the history already written down. So, and I know another example of this, when I started working with Carrie's my functional medicine coach. And so she and I worked together, but then she referred me to a functional medicine doctor who she knows and uses. And boy, let me tell you, that guy wanted to know, that doctor needed to know everything about every single pregnancy that I had. Now, if I had had something where it's all written down, how the pregnancy went, how the baby, just all that medical background, because that's how functional medicine works, then it would have been so nice for me to just kind of flip back into something that I had written down. So that would have been a lot easier than me having to go on memory. And a lot of those big events they're still in my head, but I can remember them. But still, if it's all written down, it's a lot easier. And then if the next baby, you could easily forget all of those little things that you wish you would have remembered and how you dealt with them. So it's kind of just that whole diary. And I don't know if this would be the case, but maybe Carrie would have more information on that. But as the child grows up, maybe their child has some of the same issues that, I don't know. Carrie, is some of that stuff genetic?
When we do a functional medicine timeline for a client, we actually start with the mother's pregnancy. What kind of pregnancy did your mom have? What was the pregnancy like? What was the birth like? All of that. So we go right back to the very beginning.
Yeah. Very good.
And Bekah, can I ask you real quickly, what are the dates for the November summit again?
November 1st through the 19th.
Okay, awesome. Thank you.
Did you put that link in there, Carrie?
I did.
Okay, great. All right. Well, thank you, Bekah. This is so helpful, and I hope that everyone can go and keep that book handy. Again, it's a great gift. It's super easy, great resource, and it could save a frantic, stressful night of anxiety for moms that are not sure. So And thanks again for that advice too, that it's okay to call a nurse. It's still okay.
It is.
Get a good nurse hotline, someone you could trust. And
Yes.
it's totally fine. They expect you. That's what they're there for. So it's all okay to do that too.
Mhm.
All right. Well, thank you, everyone. And if you have any questions for Bekah, I will add her, tag her maybe in the Facebook group so that, Bekah, if anybody has questions, you can jump in there and answer them. And on Facebook, we are facebook.com/hard lotion. So we'll be doing more lives. And I think there's a way to follow on Facebook to follow when we do go live. So if anybody would like to do that, then you can find out when we just decide to hop on the video and go live. So thank you. Oh, looks like Josie just bought your book. All right.
Yay!
Yay,
Thank you, Josie.
All right, everybody have a good evening, and yeah, go enjoy your families. Bye-bye.
Good night. Thank you.